Substance Abuse in Mexico and Brazil by Dakota, Emily, Julissa, and Maddie.
We will start with an overview of the topic, which is substance abuse, and an overview of the two countries we are focusing on, which are Mexico and Brazil. So, substance abuse is when someone continues to use drugs or alcohol, even when it starts causing serious problems in their life. According to Johns Hopkins Medicine, this can affect relationships, so within the family, with friends, in the job setting, as well as in the community or even at school if the person is attending school or if has kids at school. And overall, it affects daily responsibilities. Over time, substance dependence can lead to severe physical and mental health issues, as well as financial struggles, and even face legal trouble. So now let's take a look at two countries, Mexico and Brazil. Mexico is in North America and has a population of over 130 million people. Most of its population is mestizo, and what this means is that they have both indigenous and European ancestry, and a smaller percentage of its population is it's indigenous. This country's climate varies widely, with the north region being more dry and having desert-like biomes, and the south is more tropical and it's more humid overall, and even cold in the winter. Its economy is driven by manufacturing, agriculture, and natural resource mining. Now, in terms of religion, most people identify as Catholic, followed by Protestant Christianity. Now, Brazil, on the other hand, is located all the way in South America and has an even larger population, over 220 million people. The majority of the population is either mixed or white, and a smaller percentage identifies as either black or indigenous, or black and indigenous. Brazil's climate is mostly tropical, and its economy is based on mining, agriculture, and manufacturing. So they have pretty similar economic activities like Mexico does. Religion also plays an important role, and most people identify as Catholic, followed by Protestant and evangelical groups. To wrap things up, in terms of both countries, Mexico and Brazil share a rich cultural heritage with diverse traditions, music, and art that reflect their deep histories. Many languages are spoken across both nations, either both modern languages and indigenous languages as well. And their diets are a blend of ancient indigenous ingredients and modern influences. However, despite their vibrant cultures and economic strengths, both countries also struggle with significant and economic inequalities, which continue to shape the daily life for many of their people. So, yeah, thank you. All right, so moving on, I will be discussing the major issues related to law, policy, and doctrine concerning substance abuse in the countries of Mexico and Brazil. So first, let's talk about the legal framework. In Mexico, they have the federal penal code, which was created in 1931 but has been updated throughout the years. So this document defines various types of crimes and their punishments. It includes laws against corruption of minors, the use of drones for drug transport, and penalties for driving under the influence. But obviously not just these specific crimes. It includes many, many more crimes and their punishments. The implication of this document is that it influences law enforcement. This is more of a point of reference for how the law is going to be enforced. In Brazil, on the other hand, they also have something similar. They have the Penal Code of 1940, along with a drug something that they call the Drug Law 11.343, which was established in 2006 actually. So both of these, the Penal Code and the Drug Law, govern drug-related offenses, but unlike Mexico, Brazil has depenalized drug possession for personal use, choosing for alternative penalties like community service instead of incarceration. Now moving on to policies. So Mexico, the government of Mexico have created organizations like the CONADIC, which stands for National Council Against Addictions, and they have also established the PPR program, which stands for the Release Prevention Program. And what these do is that they focus on prevention, treatment, and rehabilitation for individuals struggling with addiction. Brazil, on the other hand, this drug law that I was talking about just a second ago, this one is important because it differentiates between users and traffickers, with harsher penalties for dealers while promoting social integration for users. So, just like with Mexico, the implication of this law is that it helps enforce and sort of define what the punishment will be for the people that are found in the possession of drugs, whether for dealing drugs or for personal use. But another policy that they have in place is the United Health System, which plays an important role in addiction treatment through specialized clinics and rehabilitation centers. I really like this one because the government of Brazil pays for this one, but what's unfortunate is that only about 56% of the Brazilian population have access to these facilities, so unfortunately not everyone. Finally, let's discuss doctrine, so the social, cultural, and religious perspectives. Starting with Mexico, substance like alcohol plays a major part of celebrations. So things like baptisms, birthday parties, weddings, graduations. There's always some kind of alcohol involved, and other more illegal substances might also be involved. But since these are viewed with a more negative connotation than alcohol is, people try to keep that on the low, I feel like. Now, something that's also part of the culture, this culture does not represent Mexico in any way. But there's also something that we call the narco culture, which also influences and depicts the substance abuse. So people that belong to cartels, especially the young people, they sort of, a lot of them follow this lavish lifestyle where they just consume a lot of drugs, they get drunk, and unfortunately this has influenced even the music that a lot of Mexicans listen to, because we also have this type of music called narco corridos, which are a corrido is supposed to tell a story, but instead they've taken this to the next level, and they tell stories about violence and drug wars, and in the end a lot of them promote substance abuse. Now, deviating a little bit from that, but still in the same page of Mexico, religions like Catholicism, because it's the major one in Mexico, so they discourage drug and alcohol abuse. And similar to this, there are social programs in place that actually focus on harm reduction instead of trying to eradicate the problem and get to the bottom of it, just because there's so many systemic failures within the government the Mexican government that it would be too difficult to completely address it. So that's how, socially, that's how they try to help them. Now, in Brazil, substance use is very common in favelas, which are like poor neighborhoods where there's a lot of crime and violence, and it's just very dangerous to live in these favelas. So often these stories of substance abuse and violence are reflected in the music and in the media. And similar to Mexico, a lot of religions discourage drug abuse. And in terms of law enforcement and social programs, so these work in connection, or these work with each other to address addiction and hopefully reintegrate the people that are affected by substance abuse. So in the end, understanding the legal, policy, and cultural perspective of substance abuse in these countries, this will help us see the complexity of the issue. Both nations take different approaches, incorporating a balance of law enforcement with prevention and rehabilitation.
All right, statistical information. So starting in Mexico, of the adult population of Mexico, 10.4%, 5.2 million people, have used illicit substances at some point in their lifetime. Additionally, this rate is also found to be around 5 times higher in the male population, and the use of these illicit drugs is also found to be higher in the younger age groups. Now I wanted to talk a little bit about drug use by substance. I put these into percents, and I also listed the 2 most prevalent drugs found in both the male and female population. So starting with males, marijuana is used by 14.4%, and cocaine is used by 8.3%. For females, marijuana has a 2% lifetime use, and tranquilizers are used in 1.8%. Additionally, a survey with a sample size of over 26,000 high school students and higher education students revealed that this increase in illegal drug abuse seems to be tied to the more frequent use and easier access to cannabis and crack cocaine. Now, moving on to Brazil, cannabis is the most widely used illicit drug in Brazil, with 20%, more than 30 million people having smoked cannabis at some point in their lives. The third national survey of drug abuse by the Brazilian population revealed that cocaine is the second most frequent used drug, with a lifetime prevalence of 3.1%. Along with this, cocaine has also been identified as the leading cause of drug overdose related deaths in Brazil, accounting for 47.12% of all drug related deaths. The average age for first time drug use in Brazil is around 12 to 14 years of age, which is extremely young. All right, I also wanted to add in some graphs so you could have a little bit of a visual as well. So the graph to the left is drug use by substance in Mexico. As you can see, marijuana has had an extremely high use rate for a while now, and as of recently, the use of methamphetamines has increased as well. The graph to the right is showing drug-related overdoses in Brazil, and unfortunately, this rate is increasing pretty fast.
Application to global health. The health needs of women, men, and children are greatly affected by substance abuse, specifically in Mexico and Brazil. Some ways the health of these individuals are affected include their quality of life, mental health, and treatment options. Participants in my first article were 105 Brazilian adults between the ages of 18 and 55. The mean age was 23 years. The article stated that substance use is associated with declines in a wide range of quality of life domains, including physical, social, psychological, labor, academic, and financial functioning. They used a survey to gain knowledge about the following questions, starting with use in life, use in the past 3 months, cravings, problems related to use, concern about the use by people close to the user, impaired performance of expected tasks, unsuccessful attempts to seize or reduce use, and the use of injectable substances. The quote states, cocaine use was associated with a greater negative perception of the quality of an individual's living environments was found, including his or her safety and resources in general. Bernards et al., 2018. The article stated that impairments in quality of life were detected only for the use of cocaine and analytic drugs. Overall, this article talks about how there is ample evidence linking substance use to reduced quality of life. My next article talks about mental health and substance abuse before, during, and after the pandemic. This study was conducted with university students in Mexico. A total of 2,167 students were interviewed during one of the 3 pandemic periods. This study used standardized scales measuring anxiety, depression, self-esteem, erotic response and sexual orientation scale, and substance abuse. This quote states, access to mental health services was affected, leading many young people to resort to self-medication and substance use to cope with stress. Hernandez Fuentes et al., 2024. The results showed a clear increase in the number of students with anxiety and depression before, during, and after the pandemic, leading to self-medication using substances. Additionally, self-esteem significantly decreased during and after the pandemic compared to pre-pandemic, particularly among females, also leading to self-medication using substances. Finally, there are barriers to substance abuse treatment in Mexico. Patients reported on average of 2 barriers, the main ones being not considering the services useful for them, not considering it important to attend, and not finding time to attend the consultations. The average age of onset of meth users were 19. The average length of time they had used meth was 7 years. The article states an important fact of these findings is that the participants mentioned these barriers while receiving residential treatment. This could imply that they had not found the benefit of the treatment and still considered that these types of services are not useful. Some people mentioned that legal problems were the only reason that brought them into the treatment centers. The quote states, the main barrier found was that users did not perceive treatment services to be useful. Martinez, 2023. Moving on to the application of global health for children, there are many ways that the children's health is affected by substance abuse in Mexico and Brazil, but the main ones I found were influence and mental health. The first article states studies in various countries have shown that adolescents with a history of parental use of alcohol have a greater risk of presenting alcohol problems on their own, including binge drinking, drinking under the influence of alcohol, and alcohol dependence. It says one of the most important of these contexts is when parents have the problematic alcohol use that children can potentially observe and learn in the home. The quote states, students whose mothers or both parents use alcohol had a greater risk of binge drinking. Gomez et al., 2022. Moving on to mental health, the article states key determinants of substance use included academic stress, lack of familial support, and the need for social belonging. The quote reads, drug use among adolescents often serves as a maladaptive strategy to cope with emotional and social stressors. Spath, Silva et al., 2024. It also states prevention and intervention strategies must focus on strengthening familial support, enhancing coping mechanisms, and providing accessible mental health resources.
For application to the discipline of nursing, I am going to first start by discussing education and the guidance of nursing practice, and then I will elaborate on patient care. For education, I'm going to read 2 quotes regarding this topic. The first is in relation to Brazil, and the second is regarding Mexico. The first quote reads, findings from a recent study suggest that undergraduate nurses in Brazil are not adequately prepared in the care and management of substance misuse problems. The nursing profession in Brazil faces numerous challenges in the development of professional competence of nurses in this field. And the second quote is, national and international context demands specialized professionals be able to analyze problems and present feasible scientific solutions. Mexico does not have sufficient specialized staff to participate in national drug commissions, research centers, hospitals, or academic institutions. However, nurses have made progress in addressing these challenges. A notable example is the standardization of nursing education on substance misuse and treatment, which demonstrates that nurses may be able to organize their discipline for collective goals. Both of these quotes demonstrate a lack of nursing education on this topic. And though we typically think thoroughly about education in regard to the patient's education, it is important to this subject specifically that we acknowledge the education that the healthcare staff, such as nurses, must receive first, so that they can then utilize their knowledge for patient care and education. This will eventually result in more positive patient outcomes. Because of this, we see that nursing programs are being changed to include more education on substance abuse disorders globally. Both Mexico and Brazil are great examples that there is a need to change this to further promote those better outcomes. This is absolutely necessary because substance abuse disorders continue to be a growing issue. Next, I'm going to discuss how this guides the nursing practice. Our textbook states that appreciation of the health system in Mexico can provide a clearer understanding of the context for health, illness, and care for people in Mexico. As Emily stated before, some people are not able to seek treatment for substance abuse, and it's important to notice this aspect in healthcare systems both in Mexico and in other parts of the world. By better understanding each need within any community, nursing practice will be better able to adapt to meet these specific needs as they arise. This also relates to the standards of care of the nursing practice, which is why I've included an evidence-based practice source that shows nursing practice should prioritize patient-centered care, especially for patients with substance abuse disorders. This source states, despite ongoing efforts aimed to improve treatment engagement for people with substance-related disorders, evidence shows modest rates of utilization as well as client-perceived barriers to care. Patient-centered care, or PCC, is one widely recognized approach that has been recommended as an evidence-based practice to improve the quality of substance use disorder treatment. This demonstrates that evidence on this issue guides the nursing practice to further prioritize PCC. Next, I will be talking about the patient care aspect of this topic. On the last slide, I mentioned a quote that a patient-centered care approach to this topic was proven to increase the quality of treatment for patients with substance abuse disorders. I want to elaborate on this by using a literature review done over the most effective nursing, recovery-oriented interventions for individuals with substance use disorder. It found the following themes and sub-themes of effective nursing interventions to be key in maintaining patient-focused care that promotes the recovery of these individuals. As you can see, the table included identifies the major themes found effective were PCC, empowerment, and maintaining support and capability enhancement. This includes maintaining humanness of the person, keeping recovery individualized, collaboration and promotion of autonomy, sustaining hope and future orientation, highlighting strengths through feedback, listening and stimulating reflections, connecting and reconnecting, and the practical support leading to skill acquisition. This table elaborates further on what these interventions can look like specifically. This demonstrates that not only are steps being taken to understand how nurses can gain an education on this topic, but also how they can use it to better promote these patient outcomes. These interventions allow nurses to treat each patient to the best of their abilities and requires nurses to treat each patient as their own and practice supporting patient autonomy as well as therapeutic communication. This hopefully results in more patients feeling supported in an acute setting and willing to take steps to continue seeking rehabilitation in the long term. All of these factors affect the population of patients with substance abuse disorders, which we have discussed specific to Brazil and Mexico. Because this is an ongoing concern worldwide, it is necessary that nurses have the education to combat this issue, and the nursing practice will follow evidence-based practice suggestions on patient-centered care, which is what we discussed is most effective as of today. And these were our references. Thanks.